Can you tell us about the development of the community worker service in MS Ireland?
MS Ireland has had a community worker service for longer than I've been in the organisation. So I'm in the organisation 29 years this October. And when the community worker service first established, it was really around community development. And over the years, it has morphed into all sorts of different types of services, but it's changed a lot from the community development model and more to a kind of a casework model, and which means that there's more of a focus on people with MS and their families rather than the broader community of people.
Can you tell us about any differences you have observed in the needs of people living with MS now compared to when you first started?
When I look back and think of the differences in terms of what was important to people with MS, I think when I started, it was in October of 1994, and the new interferon treatments had just come on stream at that particular time. So before that, people's experience, if you like, of attending neurology appointments was very much around go home, rest, don't do too much. And then the advent of the treatments made such a huge difference in terms of people's expectation, I suppose, in terms of what they could look forward to. So I think from the time of the interferons coming on stream, it made the whole MS space a more hopeful space for people with MS, in that there was something that they could either approach their neurologist about, they could inquire about, um, but it was also something that they themselves could invest in. If I look back and think then and now in terms of the needs, I think the needs are similar. So people are kind of always being newly diagnosed, and that's always, even from years ago, it's around. And the only word I have for this now is journeying with people from the beginning. So they get the news and they're trying to unpick what this news means to them and how they can maybe adapt in terms of whether it's through their working life, their family life. And again, people haven't changed down the decades. So people are either anticipators, they're catastrophizers. People have all sorts of personality types that they bring to hearing the news. And in terms of the needs, I think that the needs are similar. Throughout my time with the organization, I think the first one is around emotional support and trying to allow people the time to kind of to listen to themselves and unpick what the impact of the diagnosis has been, because I think that most people's experience of their consultant and other healthcare professionals in the beginning anyway is that they feel that their story, if you like, isn't heard, and that what they want is the time to I suppose it's the time to unpick and unpack what it means to them, because MS is such a different experience for everyone.
From a casework perspective, what is the biggest difference in people being diagnosed with MS now compared to 30 years ago?
I think there's a big difference in terms of almost 30 years ago and now in terms of people being diagnosed. I think the biggest difference is information. So people have access to information, and maybe some people might say too much access to information. And again, depending on your personality type. So Dr. Google is oftentimes people's first port of call. And the unfortunate thing about Dr. Google is that Dr. Google puts in the kitchen sink into terms of what's going on. So that whole space can be a very fearful space, because there isn't necessarily somebody to sit down and say to people, okay, these are the kind of things that can happen, as opposed to these are the kind of things that will happen. So I think the biggest difference is around access to information, and also that access to information is an empowering piece for people as well, in that they're more engaged now in terms of their own healthcare management, rather than being um, I suppose, rather than feeling that they expect somebody else to manage their care. So the only way I have of saying this is that I think people are more kind of co-participants in their healthcare management than they would have been in the past.
Have the needs that people typically first engage with MS Ireland for support with changed over time?
I think that initially, when people would have contacted years ago, it was around maybe information. And I think now the biggest difference is that people are looking to be signposted to relevant services. Uh, and it's a strange thing because you look back over the years and there's always gaps, but we continue to focus on the gaps sometimes and don't realize how much positive change has happened. So people maybe have greater access to physio, or maybe have greater access to their consultant neurologist. But it's kind of like the better things are, the more critical we can be of how they can be, because our expectations also kind of increase. I think the needs over time, in terms of people engaging with MS Ireland, I think they're very similar. There's a need to engage, there's a need to be signposted, and there's a need to feel heard. And I think they're the same now as they were like 20 years ago. And I think the hearing part, I think, is hugely important, because oftentimes when people are newly diagnosed, yeah, so oftentimes we go through our most recent experience of something. So if somebody in the local town or the local village or the local community has had MS and their journey has been very unkind, maybe, that's maybe where some people go to immediately, because they anticipate that this is going to be their road. And I think that the role of the community worker has really trying to encourage people to take time, that I suppose time is their friend. They don't need to know everything in this moment. And I think the value of the community worker role is that it's a relationship that builds up over time. And oftentimes the community worker is the touchstone for people, because they are a place, a safe place, where people can go, and generally the community worker's role is dealing with anything outside of the medical sphere.
What do you think has been the most notable development in the community worker space?
I think the community worker space has developed and evolved over the time that I've been with the organisation. And most of that really is responding to the needs of people with MS. I think one of the things that has impressed me with MS Ireland is that it has kind of evolved, so that our role in 1994 and in 2023 is similar, but it's also very different. And I think the significant changes have been kind of adapting to the environment, the political environment, the health environment, the socio-economic environment are hugely different from 1994 to now. So I think the community worker is constantly evolving, is constantly learning about what's available. So again, that they can be that touchstone for people with MS, that the community worker may not necessarily know the answer, but can at least guide the person to the place where the answer can be got.
What changing challenges have you observed for people living with MS during your time working in the space?
I think some of the challenges are the same, in that people are challenged with the uncertainty of their diagnosis, uncertainty around where they think they might be. And again, it's a bit like this kind of anticipatory side of things. I think the challenges that I would have experienced for people is around how kind of science maybe has changed and improved. So when I started with the organization, when somebody was diagnosed, there was loads of things that they were told that they couldn't do. So exercise was bad, and even the having children, especially for women, was seen as something that people shouldn't do. So essentially, people were told basically to go home and kind of take it easy, I guess. And the whole world since 1994 has completely changed in terms of what people now know to be good for people with MS. So exercise is good. Exercise is good for brain health. Exercise is good for lots of things. And I think the challenge that people have is that MS becomes part of the story, but isn't the story for people. So when people are making life decisions, whether it's about what kind of a house I'm going to buy, am I going to have children, that MS is a factor in it, in that it needs to be part and parcel of the decision, but it doesn't define the person or doesn't define the decision. So, for example, if somebody with MS is going to look for a house, so maybe a duplex house might not necessarily be the best option because the possibility of some mobility issue going forward needs to be factored in. So, I think people are far more aware of they're far more aware of the possibilities around their MS, but they're also an awful lot more hopeful and are making decisions that are again factoring in the fact that MS is there and that there are possibilities that change might be in people's future.
For you, what has been the most exciting development in the MS space during your career to date?
The most exciting aspects for me are kind of manifold. One is around treatments, disease modifying treatments. So just before I started, there was none. Then there was the interferons, and now we have a menu of treatments. So if something isn't working, treatments can be escalated, and people have a far more, I suppose, hopeful prospect of what's going on. And then outside of the disease modifying treatments, I think the impact of exercise has been hugely beneficial. And I've been lucky enough to be involved with an exercise program that MS Ireland have been involved in since 2006. And so MS Ireland is now one of the largest providers of physiotherapy and physical activity services to people with MS in the country. And that's a huge um, kind of advancement, I think, in that we're recognizing the importance of physio, but we're also working with research teams and looking at exercise from an evidence base so that people can I suppose, people can engage in a program with a realistic expectation that gains A, B, and C can be achieved because the evidence supports it.
Is there anything on the horizon in the MS space that you're excited about?
I think the MS space is always evolving. I think for me, the areas of things like neuroplasticity, I think is huge. The fact that the brain is so adept at kind of making changes and developing new neural pathways that people are now understanding an awful lot more how the brain works. I think also in terms of new treatments, so we've got advancements in like stem cell treatment, we have advancement in the disease modifying treatments. But I think for me, probably the biggest change has been people with MSs themselves, their kind of hunger, if you like, for information and their hunger to be heard and their hunger to be part of whatever health management plan is to be agreed with them.
Recognising the developments that have been made in MS over the past 30 years, what are your hopes for the future for MS?
I think the MS space is a very hopeful space in the sense that neurologists are learning an awful lot more about the mechanism as to how MS operates. And I think because the brain is affected, the brain is it's a very clever and a very complex space for people. Um, I think also the family members are a huge component of this, and I think that there are many things that have kind of come together to try and ensure that family members are also part of the story. So a person is diagnosed with MS, but generally people don't live in isolation; they're part of a system, and I think what's really exciting for me is that there's a greater recognition that the family system is an important aspect in terms of how a healthcare plan is developed. Um, I think far too often cognition is a part of the drama for people with MS. And I think that it's important that family members are included, especially where cognition is identified as an issue, because ultimately everybody is hoping for people to be the best versions of themselves. And given that people don't live in isolation or people don't live in an island, that oftentimes it's really important to include the system so that the system can be the best version of itself.